Electricity is a vital utility in the modern world, energizing all essential services that improves the overall quality of life, including healthcare. But not all enjoy the convenience and advancement brought about by electricity. For a lot of off-grid communities, this service remains a luxury, one that they can only dream of having. The municipality of Concepcion, Iloilo is one of the most disadvantaged areas in the country, with 16 island barangays providing access to electricity and essential health services for their constituents remain difficult.
Itong mga island barangays are places which we considered as GIDA areas, no? Geographically isolated and disadvantaged areas. That is why it's hard for us to service them, not only the health, but also education. There is always a great challenge for us bringing in goods and services in these areas because of inclement weather, bringing services to them. That is why our services for this barangay island is talagang kinukulang kami.
Barangay Polopina is one of the many island barangays of the municipality that remains off-grid. From the mainland, it takes about an hour or two via boat ride, depending on the tide to reach the remote community. But come rain or stormy weather, the Barangay Polopina Health Center tries its best to keep the health and medical needs of nearly 4,000 residents in various sitios of the island village in tip-top shape. And ready to serve in its front line are its tireless and dedicated Barangay Health Workers, or BHWs.
Our barangay health workers are actually the health education promotion officers in the barangays. So we were able to equip them with the training or basic health services na pwedeng ma-provide nila sa kanilang level. So for example of these basic services, mga prenatal services, maternal and childhood services like immunizations, prenatal counseling, family planning counseling, consultations, integrated management of childhood illnesses, na consultations at the midwife and BHW level, they can do it.
Cristina Dumaraog, or Christy to her peers, has passionately served her community as a barangay health worker for more than 2 decades. According to Christy, it was her mother who inspired her to help her fellow island residents as a BHW, particularly keeping the health of children in check.
Yung nanay ko kasi noon, isang kagawad din. Sabi niya, gusto mo mag-volunteer ka para makatulong ka kasi mahirap pag walang BHW sa isang sityo. May mga training din kami para matuto pa kami sa mga bagong mga teknolohiya para sa health ng mga pinapaabot namin sa mga tao.
Despite the glaring challenges faced by a grassroots-level health center, Christy and her fellow BHWs still remain positively committed in giving the best medical service they can to the island's residents, making the most of what they have just to provide care to all those in need.
Kahit na mga sakit na pwede lang namin mabigyan ng first aid, diarrhea, lagnat, nang kaya lang namin silang matulungan. Yung isang estudyante noon na talagang hinika siya. Eh, wala naman kaming magawa, pero ito binigyan namin ng pang first aid na doon maghinga sa supot ng tinapay.
But modern medicine requires one vital utility, electricity, one that the island and health center lacks. Though their center has the equipment to give adequate and accessible care, Christy and her fellow BHWs still resort back to manual work, unable to utilize their center's full potential.
Gusto din namin makatulong sa mga pag emergency. Kahit yun na lang sinasabi ko sa inyo nga, pag may hika, nebulizer na pwede namin magamit dito. Kasi lahat naman ng tao dito, wala namang gamit na mga generator. Sana dito may kuryente para hindi din kami mahirapan.
The lack of power in the center not only is a burden for the patients, but also for its BHWs, whom all have to adapt and improvise just to be able to commit their sworn duty to the community.
Pag may mga report kami, talagang dito kami sa labas gumagawa. Kasi mainit din ito, hindi kami komportable. Mga 18 kaming BHW. Kaya mahirap pag sa loob kami lahat. Yung iba doon nakadapa sa may katre.
Though difficult and often a thankless job, Christy continues to remain positive in her mission to help her community, putting aside all hardships to serve her people.
Iwan ko kung kailan pa ako talaga mag-resign kasi parang hindi ko na maiwan yung mga tao. Minsan kahit na, siyempre may allowance din kami sa barangay, 200. Yung nung una ko palang pasok, 200. Okay na sa akin yun. Kasi marami akong natutunan na makatulong pa ako sa mga tao.